Good day everyone. In today's class we will be discussing the group exercises or group therapy. Initially we will be discussing the individual exercise. Individual exercise mean it is the one-to-one basis exercise, and in this the therapist gives special attention. It is done in the OPDs, ICUs, in hospital settings. So when patient is in acute phase of disease or condition, these individual exercises are important. Basic advantages will be that the special care will be given to the patient, proper attention, the patient will have good rapport with the therapist, patient will be comfortable, and there will be the improvement will be well documented, and the progress notes can be maintained, and it's easy to teach the exercises to the patient, and proper psychological counseling can be done to the patient individually. And coming to the disadvantages, it could be time consuming, costly for patient, sometimes tiring for the therapist, and we need more therapists for giving the individual attention. Then too many individual attention can lead to make the patient rely on the presence of therapist as a stimulus to the activity. So talking about the group therapy, so it can be defined when small number of patients, never exceeding 6 to 8, work together in a group under the guidance of a therapist, where the stimulation which results from working with others is utilized. Basic aim of group therapy is that it provides the opportunity for the patient to practice the activities to increase endurance and his speed of performance. On the other hand, if we talk about mass exercise, it is performed by a large number of people to a formal command which is dictated by the instructor, and no or little assistance can be given to the person. So advantages of group therapy, if we talk about it, is that the patient learns to work with others and he no longer consider himself let apart from his fellow workers, and because of his own disability, so he learns to take his place with other members of the community. Secondly, the patient learns to take a measure of responsibility for his own exercises, and he is prepared toward home practice. Thirdly, the patient is given confidence in his ability to hold his own and stimulated to further effort, and the effort is stimulated by some activities which call for a mild form of competition among the candidates. While performing the exercises in group, the patient will gain confidence, and also the patient are helped to forget their disability temporarily by objective and game like activities. So basic disadvantages could be that it depends on a faulty selection of the patient. Sometimes there could be inadequate explanation to the patient, inefficient grading of the groups, sometimes overcrowding of the groups, or the poor technique of instructions can lead to few disadvantages. Now talking about the organization of the group exercises. So a few components are, first is the selection of the patients, second is grading of the groups, and number 3 is number of patients in the group, fourth is how to explain to the patient, and fifth is the technique of instruction. So selection of the right exercises given in the right time and right way is very important. So talking about selection of the patient who are grouped together should have some common deformity or disability which will benefit from exercises which are similar in character. Secondly, grading of the groups, like groups are formed according to the location and nature of the disability, age, gender, and also nature or strength, intensity of exercises performed. If we take an example, like we grade of leg exercises for the patient, so group 1 or leg 1, so all patients in this group are having traumatic injuries, and exercises which are performed, they are non weight bearing exercises. So all the group people have traumatic injuries, and the exercises which are going to be performed are non-weight bearing exercises. Similarly, group 2 or leg B, there will be the history of traumatic injury, and they are indicated for partial weight bearing exercises. Similarly, group 3 or leg C, so patients having traumatic injury, but they are indicated for full weight bearing exercises. And lastly, the rehabilitation group can be done. So this could be example of grading of the groups. Number third is the patient, number of patients. So overcrowding, it results into the failure of group therapy. So individual attention cannot be given by the therapist to the patient. So for this reason, the maximum number of patients in a group should be not more than 8. Then next is the explanation to the patient, like before joining the patient in the group, the preliminary explanation about the exercises and purpose of exercises with regard to his disability must be given. And technique of instruction, like the instruction should be given according to the need and capability of the patient. So the value of group exercises must be assessed from the point of view of benefit of the patient. So by keeping this in mind, each patient in group should be instructed. This topic is given in detail in Dina Gardnia book of exercise therapy. So you can read that in detail also. Thank you.